Haemophilus. In this lecture, we are going to discuss about the species Haemophilus influenza, Haemophilus aegypticus, Haemophilus ducreyi. Burgess classification of Haemophilus: kingdom bacteria, phylum Proteobacteria, class Gamma Proteobacteria, order Posturales, family Posturalaceae, genus Haemophilus. Haemophilus means which loves heme. So this Haemophilus group of organisms always need some growth factors which are present in hemoglobin of red blood cells. And these are small, non-motile, gram-negative cocobacilli. Sometimes these organisms are also seen as filamentous organisms, which we'll call it as pleomorphic organisms with different shapes. These organisms require two growth factors majorly. Those are X and V factors. X refers to hematin and V refers to nicotinamide adenine dinucleotide, that we can call it as NAD. And these two factors, growth factors, are always present in chocolate agar. Some of the species require both these growth factors. Some of the species will only require one factor. And these organisms grow at 35 to 37 degrees centigrade temperatures with pH 7.6, and they require 5% of carbon dioxide for their growth. And these organisms are aerobic in nature, and the important species in this genus is H. influenza, H. aegypticus, H. ducreyi, that is Haemophilus ducreyi. And the growth factor requirement for these three species: H. influenza requires both hematin, that is factor X, and nicotinamide adenine dinucleotide, that is factor V. So this H. influenza requires both these two factors, X and V factors. Whereas Haemophilus aegypticus requires both these two factors, X and V. One is hematin and other one is nicotinamide adenine dinucleotide. Whereas ducreyi organisms always require hematin, it doesn't require the V factor, that is nicotinamide adenine dinucleotide. And these Haemophilus influenza organisms, the first species, they are gram-negative cocobacillus. They require both the growth factors, X and V factors, and they always grow in chocolate agar. Whenever they grow in chocolate agar, they produces a clear colonies without any pigmentation. And these organisms, whenever they are grown on blood agar culture medium with Staph aureus, Staphylococcus aureus organism, they always show satellite phenomenon. These organisms always grows adjacent to the Staph aureus colonies as satellite colonies. So that's why it is referred as satellite phenomenon. It is one of the diagnostic feature for Haemophilus influenza organisms in this Haemophilus genus. And these Haemophilus influenza organism, depending upon their polysaccharide capsule on their surface, there are 7 serotypes that were found, and in these 7 serotypes, one serotype is highly important and highly virulent, that is HIB, Haemophilus influenza B serotype. It is referred as HIB, and this HIB always consists of a capsule which is made up of a polysaccharide called polyribitol phosphate, or it is also referred as ribose ribitol phosphate even. And the other strains which won't have a capsule are referred as non-typable Haemophilus influenza organisms. These non-typable Haemophilus influenza organisms are less invasive in nature and less virulent. They cause localized infections because they are not capsulated. They won't have a polyribitol phosphate or ribose ribitol phosphate capsule. So this is the satellite phenomenon, cartoon way of representation. Here the center, it's the blood agar culture plate. On this blood agar culture plate, the center black color line refers to Staph aureus colonies. Adjacent to the Staph aureus colonies, we can see the small circles here, which represents the colonies of H. influenza, which are growing adjacent to the Staph aureus. And this we can call it as satellite phenomenon. This satellite phenomenon occurs adjacent to staph aureus because staph aureus is a beta hemolytic organisms which can destruct the red blood cells on blood agar culture medium. Whenever it destructs, the hemoglobin consists of hemetin and NAD, nicotinamide adenine dinucleotide. So these two things are useful for the growth of H. influenza. So always these organisms grows as satellites colonies adjacent to the staph aureus colonies. So here you can see the blood agar culture plate in a zoomed view, and we can see here the white color circular areas are staph aureus colonies. Adjacent to the staph aureus colonies, you can see Haemophilus influenza colonies, which grows as satellite colonies. So it is referred as satellite phenomenon. It is this picture, this cartoon representation was done by Dr. Sudhir Khair from Florida University. Virulent factors of Haemophilus influenza. These organisms has a fimbrium which always helps in attaching to the nasopharyngeal epithelial cells and other respiratory epithelial cells, and it has outer membrane lipo-oligosaccharides, we can refer it as LOS, and this lipo-oligosaccharide always helps in attaching to the respiratory membrane that is present in middle ear areas, that is eustachian tube, which can ultimately leads to cause otitis media. So in otitis media, the major virulent factor in leading to cause the infection is lipo-oligosaccharide, which we'll refer it as LOS. It can also secrete two other factors, virulent factors, that is neuraminidase and IgA protease. One hypothesis is they always helps in entering of this organism into the human tissues, but it is not proven, unknown function, that's why it is referred as unknown function. And this organism has, especially the HIB organism, the type B organism, always have a capsule which is made up of polyribosribitol phosphate, which can be referred as PRP, or sometimes it is also called as ribosribitol phosphate. And because of this capsule, it is highly virulent in nature because it inhibits phagocytosis, it inhibits complement activity, inhibits bactericidal activity by the human tissues, and any antibodies which are produced against this PRP capsule, polyribosribitol phosphate capsule, can control this infection. Vaccination is done majorly by targeting this polyribosribitol phosphate capsule. HIV infection, the HIV H influenza B serotype infections, always we can see meningitis, one of the major complicated infection especially in children below 2 years age group, and it can cause acute epiglottitis, septic arthritis, etc. Whereas non-typable Haemophilus influenza, which won't have a capsule, they can always cause otitis media, sinusitis, bronchitis and pneumonia. Majorly this infections occurs because these non-typable organisms are not that much invasive. Whenever they get trapped in these areas, in middle ear areas or sinus areas or bronchial or alveolar areas, they can cause localized infections. Majorly we can see non-typable infections in adult patients, and HIV infections in children, high number of cases we can see in children. So epidemiology. Transmission of this infection is mainly by respiratory route, which always seen higher incidence rate in daycare centers and nurseries in lower age group children, and they always seen these organisms. Majority of the population will have this organism, especially children, adults. 75% we can see it in nasopharyngeal areas. At 3 to 4% of patients, especially children and adults, we can see H influenza B type, that is HIB type, and this HIB has 7 serotypes. HIB is most important, and non-typable organisms are less invasive and can cause infection of sinusitis, pneumonia, bronchitis infections. Whereas the outbreaks of these infections, majorly we can see it in children in daycare centers and nurseries. And the vaccination for HIB infections, that is type B polysaccharide capsule, is highly effective. Because of this wide vaccination, the number of cases are reduced nowadays. And this organism always resembles with Bordetella pertussis. There is one more organism which can also cause respiratory illness, that is Bordetella pertussis, which always looks similar to H. influenza. So this is the incidence rate of infection in children, especially this axis refers to the age of the patient, and this axis refers to the number of cases that were reported up to 1985. The statistical graph was given in 1985 by CDC, and we can see between 2 months, after 2 months, we can see higher incidence rate of influenza in non-immune people is H. influenzae infection meningitis, whereas Neisseria meningitis will cause less incidence rate in lower age groups when compared to H. influenza, whereas Streptococcus pneumonia causes less incidence rate in children, causing in fact meningitis especially in children. So high number of cases we can see meningitis cases, especially because of H. influenza. So children 6 months to 2 years, most common cause of meningitis is H. influenza, whereas below 6 months it is majorly because of Streptococcus aegypticus. Acute epiglottitis we can see between 3 to 5 years, and in adults we can see non-typable organism causing infection. So we can see a short animation of H. influenzae pathogenesis. So these are the H. influenzae organisms with polyribitol capsule, and they can be seen everywhere. Normally they can be transmitted to humans by respiratory route, with viral infections are more helpful for this organism to grow. Whenever they enters into the respiratory tract, they'll have this capsule, polyribose ribitol capsule, and that inhibits phagocytosis. So phagocytes can't take these organisms, whereas the antibiotics or the antibodies can't destruct this organism, because this organism has a plasmid, and which can gives resistant to antibiotics to this organism. They can enter into the human body bloodstream by breaking the tight junctions in between the cells. Whenever they enters, they can cause meningitis, neurological disorders. They can cause acute epiglottitis, bacteremia, pneumonia, etc. So the infections caused by HIV and non-typable H. influenza. Meningitis is always caused by HIV type B, B serotype. Otitis media is majority of the time it is because of non-typable organisms of H. influenza, which won't have a capsule. Sinusitis is also by non-typable organisms. Acute epiglottitis is majorly by type B HIV organisms. Tracheobronchitis is because of non-typable organisms which are trapped in bronchial areas. Bacteremia is majorly because of HIV organism. Pneumonia is by non-typable organisms. Clinical conditions. HIV can cause meningitis, especially in children below 2 years age group. So we can see higher incidence rate in below 2 years age group. So the symptoms what we can see in these children with meningitis is fever, headache, and they will have a poor feeding, irritation, especially below 1 year age group children. They will have a high irritation, poor feeding, and high fever. And these patients will always have a bulging frontanella, and whenever it is untreated, it can lead to seizures, convulsions, and ultimately leads to death. Whereas in elderly children, more than 1 year age group children, we can see fever, headache, malaise. They will have neck stiffness. We can see Budzinski sign in that children, and those patients will also, untreated patients, they can also lead to enter into convulsions condition, and that ultimately leads to death of the patients. And these meningitis cases can be treatable with the help of antibiotics like cephalosporins and ampicillins. Whenever we give cephalosporins, these organisms are gram negative, what happens in these cases is by destructing these organisms is always gram negative, and they can secrete the endotoxins. These endotoxins can cause severe damage by using antibiotics. Whenever we use antibiotics, these endotoxins can damage the blood vessels, that can lead to cause intravascular coagulation, blockage of blood supply to major organ systems, especially the CNS system. Whenever it involves the CNS systems by endotoxic effects, that can lead to neurological symptoms later on in their life, with paralysis or any kind of symptoms which relates with the damage of neural tissues in the brain. So to prevent this neurological symptoms, to decrease these neurological symptoms, we always start to treat these patients with steroids. Before we give antibiotics, we need to give steroids, and later on we can give antibiotics. These steroids can suppress the immune system so that we can't see any major effects by endotoxin by using steroids before antibiotic therapy. After giving steroids, we can start antibiotic therapy that can reduce that will minimize the neurological symptoms later on in their life. It can cause acute epiglottitis, especially children between 2 and 5 years age group. They will suffer with unimmunized children. They will suffer with acute epiglottitis. In these patients, we can see fever, we can see headache, we can see malaise, anorexia, plus we can see the epiglottis got swollen, and the epiglottis swollen like it looks like a red cherry appearance. Because of swollen epiglottis, the patient will have difficulty in swallowing, the patients will have difficulty in breathing, and we can see stridor in these patients. Always these acute epiglottitis patients should not be physically examined with tongue retractors, because by physical contact with this epiglottis can lead to cause laryngeal spasms, ultimately leads to respiratory arrest. So whenever we have a respiratory arrest in these conditions, always tracheostomy is one option. So these patients always has to be diagnosed by taking lateral x-rays of the neck. And the next condition we can see in these patients is septic arthritis. Majorly in children we can see septic arthritis, especially the femur joint is get affected, and these patients will always be treated as soon as possible, because these septic arthritis is not a reversible type of arthritis, and we can see pus formation, we can see decreased movement in these cases. So the treatment has to be done as soon as possible for these patients. And non-typable organisms, they can cause otitis media, middle ear infections, we can see sinusitis, we can see bronchitis and pneumonia in these patients. Because these non-typable organisms, they are non-capsulated. Whenever they get trapped in these areas, because of localized adhesion to the tissues, can lead to cause damage, because these organisms can have endotoxin, and because of that endotoxin action on local tissues, we can see otitis media, sinusitis, bronchitis and pneumonia conditions. And this is the lateral neck x-ray. Here we can see the arrow pointing region with the swollen epiglottis, and we can see the narrowing of respiratory tube, which can lead to cause stridor in these patients, difficulty in swallowing in these areas. And this epiglottis, whenever visually observed, it looks like a red swollen cherry like appearance. So meningitis incidence. So H influenza we can see causing meningitis in children about 2 months below 15 years age group. We can see H influenza infection, especially in non-immunized or non-vaccinated children. But in adults we can't see H influenza causing meningitis, because in adults they will develop the immunity after 2 years or 3 years, they start to develop this immunity. So we can see less incidence rate in adults, especially from 2 months to 2 years we can see higher incidence rate, especially in children. Neisseria meningitis can also cause meningitis in children as well as in adults, but not as higher incidence as H influenza. And strep pneumonia can also cause meningitis in children as well as in adults, and strep pneumonia always causes higher number of cases are seen in adult patients by strep pneumonia. And E. coli can cause meningitis in neonates below 6 months, below 3 months age group, higher incidence rate. Group B streptococci can also cause meningitis. Listeria monocytogenes can also cause meningitis. And all these E. coli, Group B streptococci, and Listeria monocytogenes, these organisms are always causes meningitis in neonates. Diagnosis, treatment, and prevention. The specimens for diagnosis are blood, CSF, and sputum. And by doing gram staining, we can see these organisms as gram-negative Coccobacilli. And for rapid diagnosis, we can always use latex particle agglutination test. We can find the antigen. And these organisms are grown in chocolate agar, because chocolate agar consists of both X and V factors, because the blood used in chocolate in this agar medium is lysis blood, so we can have X and V factors both together. These organisms, whenever they're grown, they appear as translucent colonies, clear colonies. And this is a chocolate agar with the organisms grown as clear colonies, transparent, clear colonies, translucent. And on blood agar with staph aureus colonies, these organisms grow as satellite organisms, satellite colonies. We can call it as satellite phenomenon. And the treatment, we can always, the drug of choice for these patients are cephalosporins. Cefotaxime or ceftriaxone can be given to these patients, especially with meningitis. And we can also use ampicillin for meningitis cases, but there is a resistance for ampicillin nowadays, was observed in H. influenza infection. And clotrimazole can be given for respiratory infections for non-typable organisms. And the prevention is always by vaccination. Haemophilus aegypticus. Haemophilus aegypticus is a gram-negative Coccobacillus organisms. It can cause pleural conjunctivitis, which is referred as pink eye. And the most common cause of pink eye is by adenovirus, but this organism can also cause pink eye condition. And whenever this organism disseminates into the bloodstream, we can see Brazilian purpuric fever, because this organism is also gram-negative, so it can secrete endotoxin. Because of endotoxin, we can see the blood vessel damage, the capillaries are damaged, and the blood oozes into the tissues. But that's why we can see purpuric rashes with fever whenever this aegypticus organisms get disseminated into the bloodstream. That leads to cause Brazilian purpuric fever, and often you can see in epidemic forms. And high number of cases you can see in children and infants. And this aegypticus organism can be easily controlled by using sulfonamide, sulfur drugs, or gentamicin. Haemophilus ducreyi. It is a sexually transmitted organism, Haemophilus ducreyi, and it is gram-negative Coccobacilli, and sometimes it appears as long-chained organism. Because of this long-chained appearance, these organisms looks as school of fish pattern. So this is the school of fish pattern in gram-stained smears. So these tiny organisms are Haemophilus ducreyi. They all in group like a school of fish, and they won't have any capsule, non-capsulated organism, seen in genital regions of humans, and can be transmitted by sexual contact. So this is one of the sexually transmitted organism in this group. In men we can see pronounced symptoms. In men we can see this organism causing an ulcer called chancroid, and painful ulcer in the genital areas, very slow healing. And adjacent to this ulcer, we can see the lymph nodal enlargement, especially the inguinal lymph nodes. We can see pus formation in the lymph nodes as well as around this organism, and it is a painful ulcer with soft base. We can call it as chancroid. It is different from canker, which is caused by syphilis. It is chancroid. This organism ulcer, we can call it as chancroid. So this is a chancroid, raised edges, slow healing, soft base in the genital areas. And in women, very minimal symptoms or mild symptoms. We can't see most of the time we can't see any symptoms in females. And these cancroids always helps in HIV transmission, increased incidence of HIV infections, because this patients will always have an ulcer with which can get HIV infections whenever they participates with sexual contact with HIV patients. Diagnosis always can be done by DNA probe, which is a serological test which can identify the exact genome of this organism. And the treatment is cephalosporins. We can use cefotaxime or cefotriaxone. Any one of this drug can control this infection.